Order, members. It's now time for questions to the Minister of Health. The questions have been rescheduled from the 22nd of February. Questions 1 and 7 have been withdrawn, and I call Thomas Buchanan.
Deputy Speaker.
Minister.
I thank the member for his question. Deputy Speaker, members will be aware that virtually all waiting times, not just first consultant-led outpatient appointments, were in crisis at the return of the Executive in January 2020. So whilst the pandemic has exacerbated the situation, we must never forget that it did not cause it. This is not the first time that Northern Ireland has faced issues with waiting times, because prior to 2005, our hospital waiting times were the longest in the United Kingdom. But by 2009, the situation had broadly stabilised and remained relatively stable until 2013-14. Then, through a combination of one-year budgets, poor performance management and a lack of serious strategic oversight, the situation shamefully deteriorated to the extent that it did. Members will know last June I published the Elective Care Framework, which set out a detailed series of time-bound, immediate, medium-term and long-term actions to address our unacceptable waiting lists. A number of initiatives are well underway, and that includes the payment of enhanced elective care rates to staff in specific key areas of work, the introduction of mega clinics to maximise patient throughput, the introduction of cross-border reimbursement scheme, as well as a move towards leasing health and social care theatres to independent providers at times when they otherwise aren't in use to address current backlogs. I made it clear, however, that certainty of investment through multi-year budgets would be absolutely critical for the delivery and the actions and the targets that were set out in the framework. And the recent resignation of the First Minister, I believe, has cruelly robbed patients and our staff of the prospect of a 3-year budget. And I cannot emphasise, Mr. Speaker, how frustrated I am that some in this place are so willingly repeating the mistakes of the past. The task at hand has been made immeasurably more difficult.
I call Thomas Buchanan for supplementary.
Thank you, Deputy Speaker, and thank the Minister for his response. Now, I note the number of initiatives that the Minister keeps telling us is ongoing with regards to waiting lists and seeking to get them brought down. And again, it's always pointed back to the pandemic, and it seems to be that everything else was put on hold because of this. And one thing that concerns me is these people that are red flagged for cancer. And they have, when they're red flagged, we all know there's a number of weeks, 6 weeks I think it is, until they're taken for their surgery. Please. And yet, some of these people that are red flagged, Minister, are waiting for months on end. Now, what are we doing to try and deal with this particular situation? Because we all know that cancer is as deadly or much more deadly than COVID has ever been. So what are we really doing to get this particular matter addressed?
No, and I thank the member, and he makes a very valid point in regards to the work that we need to do in regards to cancer, and that's why I've deliberately set out the cancer strategy and the work that we need to do there to get on top of that. In regards to red flags, the member will be aware that the number of red flags that are either cancelled or usually rescheduled within a pretty quick time frame to make sure that those patients can be seen as quickly as possible, and that's why it's important for us to ensure that we have as few COVID patients, not just within our hospital systems, but also within our intensive care systems as well, so that we can utilise that capacity as well for those people who need to come forward for those more serious operations. If the member has a specific constituent in mind, if he wants to communicate with me, I'm glad to get back to him.
I call Colin Gilden.
Minister, the 3-year budget prioritised health and indeed set aside funding, as you stated, for the elective care plan. Now the DUP have walked away from their responsibility, what impact will that have in relation to waiting lists?
Yeah, I thank the member for his point, and I did welcome the fact that health had been given priority by the Executive in the budget, and that was made a commitment made by all ministers and all parties. However, it's important to note that the lack of a recurrent investment that the service has received over the last number of years, not just simply in future years, means that it is needed simply to ensure that our existing services are funded on a sustainable basis, and it won't fully resolve the financial gap that is facing the health system as we move forward, but that inability to plan and put those transformation projects on a sound, firm financial basis makes it all the more difficult for us. So the likes of our our cancer strategy, our elective care strategy, our mental health strategy, all becomes a bit more difficult when we don't have that recurrent budget.
I call Colin McGrath.
Deputy Speaker, waiting times are impacting right across the health service. I had more reports again in my constituency at the weekend where an ambulance, it took 30 minutes to arrive and regrettably the person passed away. This is something that's happening regularly. What are you doing about those types of waiting times as well?
And I think the member noted a petition already out in regards to that. I'm not sure if the petition will also address the budgetary pressures that we're currently under as well, but that would be welcome that issue is highlighted as well. The member will be aware of the number of initiatives the Northern Ireland Ambulance Service are putting in place to meet the needs of all the population of Northern Ireland, should they be rural or urban. And they notice the response to Maggie's call at the end of last week, where we'll actually see our Northern Ireland Ambulance Service and Northern Ireland Fire Brigade working in partnership in regards to cardiac response, and that's a programme I want to see brought in phases as quickly as possible as well, so that we can truly look at those different ways of working together to address what is a challenging situation in Northern Ireland.
I call Rosemary Barton.
Thank you, Minister, for your answers so far. Minister, can you provide an update on what extra activity you have been able to deliver following the decision to allocate an additional 90 million, albeit non-recurrent, in the absence of a multi-year budget to tackle waiting lists in the current financial year?
And I think the member has indicated in the initial answer in regards to what can be done in year with substantial amounts of money, but it does become all the more challenging that it's not actually recurrent. As of the end of December 2021, an additional 157,687 outpatient and allied health professional assessments, diagnostic tests and inpatient and day case procedures have been delivered through those waiting list initiatives, both in health and social care and through the independent sector. So it does show that 90 million has already brought forward another over 150,000 people being seen at somewhere within our health service. If that money was recurrent, it would really make a large difference as to what we can strategically plan, but also what we can strategically deliver as well.
And I call Andrew Muir.
Thank you, Mr. Deputy Speaker. When waiting times in Northern Ireland are now not just weeks or months, but years, at what stage do we in Northern Ireland seek assistance outside Northern Ireland to get people off these waiting lists?
I think the member for his point, he will be aware that we did instigate the cross-border initiative, although again only for 1 year because of the financial pressures, and we have been utilising that, where we've been able to send people to the Republic of Ireland through a cross-border healthcare directive. We have seen a number of people already utilising that to actually look for that assistance where we can buy it as well. But the member will be aware that COVID just simply wasn't a problem that the Northern Ireland Health Service faced, but all our health services across the world, across the UK, where we would have been utilising that additional international capacity, has been taken up by those same health services in those different countries as well. So the availability of being able to purchase international procedures is not as readily available as it has been in the past.
Moving on, I call Philip McGuigan.
Cast Everett 3, question 3.
I think the member, adult daycare and short breaks are still subject to nationally agreed health protection guidance to keep service users safe. Dynamic risk assessments of each setting and implementation of infection control measures ultimately determine the level at which services can be delivered safely. On my behalf, the Chief Social Worker wrote to Trust to outline my expectations on the implementation of the pathway to remobilise adult daycare, short breaks and transport, and to seek an updated position on current service provision. As of 15th of February, the Northern Health and Social Care Trust provides a day service of 81% of their pre-pandemic clients in adult day centres. The Trust's approach to provide as many people as possible with the opportunity to attend respite has meant, however, that some clients have had a reduced number of attendances each week. The volume of daycare attendance is currently at 63% of pre-pandemic capacity, and the Trust have provided a range of alternative services to mitigate the reduction in capacity. However, it is recognised that respite services must be fully restored. The Northern Trust have provided an indicative time frame to fully restore services to pre-pandemic capacity in adult daycare centres by the 27th of March and short break capacity by the 11th of April. This time frame is subject to any further surges or localised outbreaks of COVID-19, and a formal review of the implementation of the pathway and remobilisation will be undertaken in late spring 2022.
Call Philip McGuigan for supplementary.
Minister, I appreciate the response, and for those who use Rainbow Lodge in Ballymena and other respite and day centres services in our own constituency, they are invaluable. They can help provide a few hours of relief and support when families need it most. So just going above the detail that the Minister has already given, can he say or ensure that the Trusts resume full services and ensure those who need it get the respite care they have been able to access for some time?
And I think the member, he did mention Rainbow Lodge, and I'm aware a number of inspections have taken place in Rainbow Lodge by our QIA, and these inspections have raised some concerns. The areas for improvement of care within Rainbow Lodge have been identified, and my officials are working alongside Health and Social Care Board and the RQIA to ensure services being delivered at Rainbow Lodge are compliant with that. But the member will be also noting in my first part of the answer, I did indicate in regards to where the Northern Trust is, and given that indicative time frame to fully restore services to pre-pandemic capacity in adult day centres, and that's to be done by the 27th of March.
I call Mervyn Story.
Deputy Speaker, and thank the Minister for his answer, in particular in relation to the work that has been done to date by the Northern Trust. But will the Minister also give an undertaking that the assessment of those people who use the respite services will be a rigorous assessment, given the impact that COVID has had and the time that they have been away from the service provision, and that whatever additional support and help is needed for those individuals will be provided, especially in regards to their health and well-being?
And I thank the member for that point, because it is a valid point in regards to those who haven't been able to get the full gambit of the respite services and support that they have. And that's when I asked the PHA to conduct the review with the Chief Social Worker, the 4 key guiding principles that I asked and the Chief Social Worker asked at that time to actually underpin the proposed pathway to restate our services were to make sure that those services were person and family centred, that they promoted health and well-being, and that they actually worked in partnership with families and service users, and they were underpinned by that proactive surveillance that the member actually refers to make sure that any service that an individual is returning to is fit for purpose and meeting their needs. So it must be person-centred and specifically focused, but also support the family as well.
I call Steve Aiken.
Thank you very much indeed for the Minister's answer so far, and welcome back, Minister, as well, and good to see you here. The value of respite services is undoubted, but only for service users, but just as importantly for their families and carers. The Minister took the right decision last year in ordering the PHA review, and I welcome that its implementation will be formally reviewed. Can the Minister confirm that once finalised, all the Trust rebuild plans will be published online in order to provide maximum transparency and assurance? Thank you.
And I thank the member for the point. He will be aware that over the rebuilding phase that we've been taking over the last 18 months especially, that all trusts have been publishing 3 monthly chunks at that, and in part of the review that I've asked all trusts to implement in regards to rebuilding respite care, that they do publish those plans as well, so that members are fully aware, families are fully aware of the targets that have been set and what I expect of them.
I call Jim Allister.
Minister, 26 days, which is what it is, the 27th of March, is a very short period in which to attain 100% restoration. Is the Minister confident that can be done? And in that regard, are the ancillary support services, such as adequate drivers for taking people to day centres, in place? Because I've had cases where the families have been told we can only offer 2 days a week or 3 days a week because we haven't got the drivers. Is that problem being sorted?
The member will be aware is actually one part of the review was actually transport as well, not just the physical location of where respite and care was being provided as well. So that is part of the implementation plan. The Northern Trust have given me a commitment that those services will be restored by the 27th of March for the adult day centres and short break capacity by the 11th of April. But as I did say in my initial answer, that time frame is subject to further surges or localised outbreaks of COVID-19, which I hope we have none.
Moving on, I call William Irwin.
For Mr. Speaker.
And I thank the member for his question. It's not the responsibility of my department to recruit health and social care staff. That responsibility lies with the employing organisation. And it's unfortunate and disappointing the Southern Trust had to take action in respect of emergency surgery at Daisy Hill Hospital. However, I recognise that this action had to be taken to maintain safe services, and we cannot compromise on patient safety, and it must always be our #1 priority. The operational decisions taken by the Southern Trust should be viewed in that context. This is a temporary change, and I expect Southern Trust will do all it can to seek to recruit additional consultant general surgeons to reinstate services as quickly as possible. And I do recognise that this will be challenging and will likely take some time. It's unfortunate reality that a number of our hospitals, particularly the smaller hospitals, face an ongoing challenge in recruiting and retaining specialist clinicians. Hospitals in other jurisdictions face similar issues, and no amount of additional funding or workplace planning can resolve this challenge alone. I therefore ask the Health and Social Care Board and the Southern Trust to take the appropriate and feasible steps to ensure that the consequences of these changes are managed in a way that actually minimises the impact on the local population and the risk of increased pressures on other health trusts. I've also asked that fresh efforts are made to secure consultant general surgeons at the Daisy Hill Hospital site, while the Southern Health and Social Care Trust develops proposals for a sustainable long-term model of care for general surgery across both Daisy Hill and Craigavon. The Trust has advised that it is due to commence recruitment for 4 consultant surgeon posts with support for specialist interests. These posts will specify the need to work across all Southern Trust hospital sites, as the Trust does not have permission from the Royal College of Surgeons to advertise for consultant surgeon roles with speciality roles for Daisy Hill Hospital alone. I receive monthly updates on the situation, and that includes progress on securing additional medical staffing for the site. And I would appeal to local elected representatives to continue to work with trusts to promote their local hospitals and local areas and to help attract new staff, because that action clearly demonstrates the fragility of parts of the system. I've said before, and I will say it again, if we are to deliver the step change in health services we need, including general surgery, critical to addressing our waiting lists, we will need every inch of capacity at all of our hospitals.
And can I remind the member, if he needs additional time, he can request it. I call William Irwin for supplementary.
Thank you, and can I thank the Minister for his response, and again I too welcome him back, and good to see him back to health and strength again. Would the Minister agree with me that it is vitally important that consultant general surgeons are back in place as soon as possible?
I definitely would, and that's what we've been supportive of the entire time, but there are challenges in recruiting them, and that's why I've asked that all elected representatives in the area actually play a positive role in making the hospital an attractive site to work in, and the area an attractive site to actually recruit to as well. I see your colleague, Mr Story, nodding behind you. He'll recall the exact same challenges that we had in Northampton in the Causeway Hospital, and it was through productive, positive engagement with elected representatives, working with Trust Management, the Health and Social Care Board and the Department of Health, that has actually saw quite a transformation in the current outworkings of Causeway Hospital, and I would like to see the same for Daisy Hill, so that's why I asked for all elected reps to support us in that effort.
I call Liz Kimmins.
Can thank the Minister for his answer, and I mean, just to reiterate what you said, I think it is very important that we create a very positive image of Daisy Hill, and something I have been championing in my own area. But Minister, what has happened at Daisy Hill is a service collapse, basically as a result of staff shortages. And I know you said recruitment is not within your remit, but I think the fundamental issue is around workforce planning and a lack of workforce planning within the department. So Minister, are you able to outline what other services may be at risk of collapse for the same reasons, and can you confirm if the department's review into urgent and emergency care, which is yet to be published, will consider the crucial issue of workforce recruitment?
And I thank the member. An effective force planning is a key theme to the Health and Social Care Workforce Strategy 2026, delivering for our people. It was actually published in May 2018 when there was no Minister of Health. The aim is to develop by 2026 to sustainably fund an optimum workforce model for our reconfigured health and social care services. And that challenges across a number of surgical specialities. The surgical workforce reviews, current and planned action as actually of the 8th of February 2022, currently being considered by my department, includes vascular surgery, surgical specialities, general surgeries, cardiothoracic surgery, ENT surgery, neurosurgery, paediatric surgery, plastic surgery, and a number of other specialities. But it's that attractiveness of a site to work in and a trust to work for that helps. And if there's a general message being put out by elected reps in an area that either the hospital is under threat or the trust's under threat or the hospital itself is not an attractive place to work, it makes it all the harder for the trust to recruit to those areas.
Justin McNulty.
Minister, the Southern Trust has said that despite repeated recruitment attempts, they have not been able to fill emergency general surgery post at Daisy Hill Hospital, and they say this has forced them to remove this service from the hospital. However, in responding to a question I put to you on the 20th of January in relation to recruitment, you indicated that the Trust has last advertised for a permanent general surgeon position for Daisy Hill Hospital on the 5th of October 2019. The 5th of October 2019. This is either a symptom of woeful mismanagement or willful indifference. Which is it?
And here the member is once again attacking the Trust rather than supporting it and actually trying to recruit those positions that are actually at a premium, not just across Northern Ireland, but across these islands as well. I'm aware of the member's statements in regards to Daisy Hill and the difficulties that he brings. I'm also aware of your own party leader's comments in regards to the future of the health service and how he's actually said that, I think he conceded, that the Republic of Ireland's health system is a major turn-off as far as reunifying the island goes, even for people who are convinced nationalists. But I see that the member is trying to rebadge Daisy Hill as some hospital that will actually cover not just parts of Northern Ireland, but parts of the Republic of Ireland. I would rather see Daisy Hill utilised for the people of Northern Ireland, the people of Newry and Armagh, the people of South Down as well, who are actually paying in to the National Health Service as well, rather than it being politicised because we're coming up to an election.
Moving on, I call Alex East.
Question number 5, Mr Deputy Speaker.
I thank the member for his question. The South Eastern Trust is currently preparing an outline business case to consider accommodation requirements for a full range of services. That includes a minor injuries unit delivered as part of the future service model for the Ards and North Down area, taking advantage of the existing estate where possible. Until the outline business case process is complete, specific detail regarding the plans for a primary and community care centre in Bangor cannot be provided at this time, as this will be examined and detailed at the outline business case stage. The Trust remains committed to working with the Health and Social Care Board and my department to progress this project as soon as possible to deliver new primary and community care infrastructure for the Ards and North Down population. Funding for hub schemes will be considered alongside other capital priorities as my officials continue to evaluate what can be funded with the draft 2022-25 budget settlement. Allocations will remain subject to final budget confirmation and it says my approval, but the Minister of Health's approval.
I call Alex Easton for supplementary.
Thank you, Mr Deputy Speaker, and thank the Minister for his answer. I'm particularly pleased to hear that a minor injuries unit will be considered for the community care centre in the future. However, the current Bangor minor injuries has been closed for 2 years, and unless you as Health Minister tells the South Eastern Trust to reopen it again, I fear it may not reopen until a community care centre is built. So could I ask the Minister, could you maybe speak to the South Eastern Trust to reopen the Bangor minor injuries unit?
And I thank the member, and he will be aware that the current consolidation of the Bangor and Ards minor injuries unit on the Ards Hospital site actually remains under continuous review as part of the Trust plans for rebuilding services. But due to the ongoing impact of COVID, the Trust is not able to provide a definite date for the reopening of Bangor Minor Injuries Unit at this time.
I call Alan Chambers.
Mr Deputy Speaker, can the Minister provide an update on what facilities might be envisaged for the proposed primary and community care centre in Bangor?
And I thank the member. Plans to replace Bangor Health Centre and Bangor Hospital with a new primary and community care centre were included in the Primary Care Infrastructure Development Strategic Implementation Plan. This will create an integrated model of care in an environment which will maximise multidisciplinary and professional team working and encourage shared opportunities for developing links within health and social care and with external healthcare partners. The plans envisage a new centre in Bangor and assumes that accommodation will be required for at least 5 practices to service approximately 30,000 patients, and that's in the new Bangor Primary and Community Care Centre. The outline business case currently being developed will fully explore the service need and accommodation requirements for a full range of services to be delivered as part of the future service model for the Ards and North Down area, and that's taking advantage of the existing estate where possible. The purpose of an outline business case is to consider all the various options available so that an informed decision can be taken on what option provides the best value for money to meet the identified needs and objectives of the project. But as the member will be aware and will understand, it would not be possible to preempt the outcome of the business case process at this point in time.
I call Stephen Dunn.
Mr Deputy Speaker, given the growing population in Bangor and the surrounding areas, and indeed the pressures on our local emergency department in the Ulster Hospital, is the Minister committed to delivering this multidisciplinary health centre under one roof, and does he believe that is the best model to improve patient outcomes?
I do, and it has been a direction of travel, not just for me, but also for my department in regards to the development, and that's why the outline business case will be of specific importance, and I've said until the outline business case process is complete, specific detail regarding the plans for a primary and community care centre in Bangor cannot be provided at this time, but will be examined and detailed at that stage. But as the member will understand, it's not possible to preempt the outcome of the business case process at this current point.
And I call Rachel Woods.
Sorry, Mr Deputy, is that for question 6 or on this question?
Right, this question.
This question. Oh, thank you very much. I thank the Minister for his answers. In terms of the outline business case, is there any rough completion of when that would be done by the department? And also, could the Minister provide an update on Rivara House, please?
I don't have an update on Rivara House, but I'll write to the member with that. In regards to the outline business case, as soon as that can be brought to my department, we'll consider it in regards to the budget process that we're currently going through at this point in time. It will, as I said earlier, funding for the hub schemes will be considered alongside other capital priorities as my officials continue to evaluate what can be funded within even the draft budget of 22-25 settlement, because allocations will remain subject to that final budget confirmation and the Health Minister's approval.
Deputy Speaker. Minister, running through all of the questions you've been asked this afternoon is the issue of vacancies, and the member raised it earlier. But on the 10th of February, the British Medical Association raised concerns of the 300 vacancies for consultants and drew reference to the fact that there are pay disparities with the rest of the UK, and I know that there are problems with the South as well. So I'm just wondering what your department's doing to actually bring parity to pay here. Thank you.
Can I remind the member this question was about Bangor, including minor injuries unit. I'll ask the Minister to choose whether he wishes to answer or not.
And I thank the member that in regards to the BMA reporting consultants, active recruitment to permanent vacancies is led by each trust, and in the longer term it is through increased investment in pre-registration education programmes that actually creates the labour supply necessary to meet the growing demand for services. The ability to grow our workforce supply depends on the availability of significant recurrent investment in both pre- and post-registration training, and I continue to strive to ensure that the Department receives the financial resources required to make that essential investment. And I recognise that the ongoing significant increase in agency and locum expenditure is also not sustainable, particularly at a time of serious budgetary pressures across the health services.
And that is the end of our period of time for listed questions, and we now move on to topical questions. And I call Mervyn Story.
Thank you, Deputy Speaker. Minister, you just in the previous question time had reference to the launch of Maggie's Call. But could you confirm that after seeking legal advice, the Chief Fire Officer has suspended the rollout of this particular initiative? And it is obviously of great concern given the publicity that there was around this particular issue and given the importance of the issue that we're dealing with.
I thank the member. I am aware that there is correspondence between the Chief Fire Officer in regards to legal issues that have been raised by the Fire Brigade Union in regards to Maggie's Call. It's unfortunate that it would stall what has been, I think, a very proactive campaign by Maggie Black's family and a willingness in the Carnlough Brigade, especially in the station as well, to roll that out as quickly as possible.
Call Mervyn Story.
Yeah, thank you, Deputy Speaker, and thank the Minister for his answer, and also concur with his comments. But will he give the House an assurance that the fire stations in Northern Ireland will be given the adequate training, that every resource will be put in place to ensure that there is no liability to the fire officers, and that the training will be sufficient to ensure that this is done in a way that is professional and safe?
I can't give the member that commitment, because this was actually a joint initiative between Northern Ireland Fire and Rescue Service and the Northern Ireland Ambulance Service, and it was actually the ambulance service that were providing that training, and it was specifically for cardiac response. So they provided the reassurances, and that again was the boards, the chairs of both organisations working together to make sure that both were satisfied that what was being provided was up to a standard that provided them with the reassurance as boards, that they could provide me with that reassurance that they were content with what is the aim of Maggie's Call, to make sure that we can get people seen as quickly as possible, and I'm sure the member will support me in achieving that same aim.
And I call Colm Gildernew.
And Minister, I was going to ask around the day centres, around the publication of plans, but I realise you have given some answers partially, and I'll take a look at that. So instead, I would ask then, how many staff are currently still relocated from the day centre and respite centres out into other health settings as a result of the COVID pandemic?
I thank the member for his very specific question. I don't have a specific answer for that number, but I'll get it to the member in writing as soon as I can.
Call Colm Gildernew for another question.
Minister, can you commit that those staff will be prioritised to return in a coordinated way with the rebuild plans, and will you also commit to ensuring that the Trust publish those plans as quickly as possible?
And I thank the member, because I know it is something that he's raised a number of times in regards to rebuilding those services. When the trusts publish their rebuild plans, you'll be able to see the steps being taken, and I think the indication and the commitment given by the Northern Trust sets an example and sets a lead for the other trusts to follow in regards to their ambition and their desire to get those services back to pre-pandemic levels as quickly and as safely as possible.
And I call Deborah Erskine.
Mr Deputy Speaker, the Minister will know that I have written to him asking for an urgent meeting in relation to GP services in the Western area. I am deeply concerned about the staffing levels in my constituency for GP practices. So would the Minister please detail what steps he is taking to strengthen the staffing levels in our GP surgeries to ensure that we have a service which is there for the future at the point of need? And will he commit to meeting with me and those GPs?
My apologies, I'm unaware of the request for a meeting, but I'll get back to the office and follow up for the member, because I know any engagements that we've had with the member in regards to health provision, especially in the West, has been productive in regards to what has actually been brought to the table, so I'll follow that up for the member. The member also led an adjournment debate in regards to GP services just towards the end of last year, and there were a number of initiatives and models and support mechanisms that were raised at that point that still stand, and that is in regards to the additional funding that has been put in place to support GPs over the winter period, but also how we look to ingrain and actually enhance the services and the provision that they provide. Because I think one of the things that the member has also, and I thank her for it, is actually the positive portrayal of our GP services, where so many others have taken the opportunity to actually criticise them for the work that they've continued to provide and the support that they've continued to provide through the pandemic as well. So I'll check up on that request for a meeting for the member.
I call Deborah Urson for supplementary.
Thank you, and I thank the Minister for his answer and for following up on the meeting. In terms of MDT allocation, that is one of the things that GPs have said in my area will significantly help them in their GP surgeries. Unfortunately, I have not seen MDT funding reach past the Ballygolly roundabout, and I would like to ensure that we see that funding coming down to Fermanagh and South Tyrone.
Can we have a question, please?
So could the Minister detail to me when he is hoping to make any announcement in relation to further MDT allocation, and whether my area, which is of greatest need, will see that money?
And to thank the member for her question in regards to MDTs. Again, she'll be aware that the Primary Care Multidisciplinary Team Programme, with that, over 620,000 citizens have now access to physiotherapy, social work or mental health services in their local GP. There are currently around 320 whole-time equivalent frontline staff working across 99 GP practices in 7 GP federations. And I fully recognise the significant challenges which are faced by primary care colleagues in either incomplete or non-MDT areas, and their eagerness to begin introduction or to complete the rollout of the MDT model to help stabilise vitally important primary care services to their communities. And I'm committed to extending the model across Northern Ireland. Work is underway to develop a plan for the further rollout of MDT model. This is challenging given the current uncertainty over the budget and the known workforce issues in key professions. But I am pleased that the programme has recently been able to agree a draft running order for how the programme will be rolled out across Northern Ireland, and within that running order the South Western Federation have been identified as one of the early areas for further expansion. The programme team will be engaging further detailed work involving key stakeholders and GP federations, Health and Social Care Trust and professional leads to complete the work on the rollout plan, and that includes a high-level timeline for completion. As I've said already, the speed at which any agreed plan can be implemented, however, will depend on the availability of appropriate funding. That includes capital funding and suitably qualified and experienced staff.
I call Stephen Dunn.
Thank you, Mr Deputy Speaker. High Street pharmacists continue to provide blister pack medication patient support, but they do so currently as largely a goodwill gesture, and considerable time and resources are taken up to provide this vital service. Can the Minister provide any update on resolving this current issue?
I thank the member. I'm due to meet Community Pharmacy ANI either towards the end of this week or the start of next week in regards to actually the commissioning plan for 22-25. My department in the Health and Social Care Board has been working with Community Pharmacy, the representative body for community pharmacists, in the development of a commissioning plan for the community pharmacy services. And in 21-22, the focus was on the provision of core services, including dispensing, repeat dispensing and adherence, and some activities and services that ensured access to medicines and advice for the public, including vulnerable groups and those receiving end-of-life care. This ensured that local pharmacy services will be available to meet the needs of people of Northern Ireland and to support the pressures within our health and social care system. We have agreed a 3-year commissioning plan for 22-25, but again subject to the agreement of a funding envelope. And that 3-year plan aims to consolidate the build on the considerable advances seen in community pharmacy services and the role of local pharmacists and pharmacy teams that the populations have benefited from in the last 2 years. Community pharmacies have played a pivotal role in delivering health services to communities in Northern Ireland during the pandemic, and they have and continue to be the most accessible healthcare professionals on the front line of community health services during our response to the virus. And in looking to the future, it's important that we continue to work together to build on the significant successes that community pharmacy has had and continues to have.
I call Stephen Dunn for supplement.
Thank you, Mr Deputy Speaker, and thank the Minister for his answers. And pharmacists do want a properly commissioned, properly funded and properly resourced service, and patients, as you have said, rely on it, particularly elderly, vulnerable and carers. Is the Minister committed to resolving this and providing that much needed support?
It's actually part of the discussions that have been had in developing the commissioning plan for 22-25. So as I said, we've agreed what the commissioning plan actually looks like, but it is subject to the agreement of a funding envelope, and the 3-year plan aims to consolidate and build on the services that we've seen on the last 2 years, but also the good working relationship that my department, the Health and Social Care Board and Community Pharmacy and I now have through the very close working relationship we've had, especially over the last 2 years.
I call Philip McGuigan.
Good, last can Collier. And Minister, in a similar vein to a previous question, many constituents of mine are still having problems securing GP appointments, resulting in worry, stress and frustration. So over and above the issue of staffing, which you've answered, will you commit to reviewing what support is available to struggling GP practices, including those on multiple sites and those with a higher number of patients per GP?
That ongoing engagement between the Health and Social Care Board and GP, the Royal College of GPs and the GP Committee for Northern Ireland continues in regards to what additional supports we can actually provide them. As I said, we supplied additional funding, especially to get them through the winter period as well, not allowed an increase in investment in telephone services and other additional supports that our GP practices can actually use to make sure they get in contact and can support as many patients as possible.
I call Philip McGuigan for supplement.
Good, thanks, Minister, for your response. And just following on again from the previous question, is the pressure on the GP practices expected to impact on the much-needed rollout of the multidisciplinary teams? And in your draft running order, maybe can you confirm or tell me when the rollout is going to take place within the Northern Trust area?
The final running order has not yet been agreed, but as I said in response to Ms Erskine in regards to the value of in regards to the value of multidisciplinary teams is making sure that we have the available workforce as much as the available funding as well, but also capital investment, because with multidisciplinary teams comes the need for an increased footprint where those additional patients can be seen by the additional medical professionals that actually multidisciplinary teams bring onto a site. So it's making sure that we can get all those 3 tracks running at the same time, where we've got the staff, the funding, but also the footprint for them to see as many patients as possible.
And I call Diane Dodds.
Thank you, Mr Deputy Speaker, and thank you, Minister, and again, good to see you back in the Chamber. Minister, would you give us an update on the 23 million that was announced for domiciliary care in November and the impact that it has made on bed waits in hospitals?
And I thank the member, and I know this is something that she has been following up on very methodical and very astutely as well, because as the timely discharge is essential to the effective flow through your hospitals and to avoid overcrowding. To tackle this issue, the Health and Social Care Board and the Public Health Agency has established a regional discharge group, and that has identified 3 priorities to expedite discharges, and that's on top of just the simple the investment of the 23 million. The 23 million in November was to improve the terms and conditions of the independent sector domiciliary care workers. The aim was to add capacity to the system and to facilitate timely discharge, and early feedback suggests that this intervention is beginning to make a difference. The wider population also has a role to play in improving discharge and flow through your hospitals, and it's critically important that all patients deemed medically fit for discharge vacate the hospital bed as quickly as possible to make way for those who are more acutely unwell.
And that is the end of our period of times of questions to the Minister for Health. I would ask members to take their ease for a few moments.